All right, good morning, everybody. Thank you for coming out on this beautiful, not so humid and hot day like it is lots of years. I want to thank everyone on the auction committee for the endless hours of preparing and planning for today. I thank each one of you who donated resources, items for the auction, and every person here working today to allow us at the Clinic for Special Children to do our work in continuing to care for those in need among us each and every day. Finally, I want to thank every person who chose to come out today and support us, whether that's through purchasing one of the large quilts here today or a donut. Every bit counts. This year, as I thought about my remarks this morning, I reflected on the concept of old and new, past, future, foundations, and new beginnings. From the very inception of the Clinic for Special Children in the 1980s, to the first building, to adding on an addition to that building, and now, in 2024, moving to our brand new facility in Gordonville, PA. This has all started with the question that we ask ourselves: where is there a need that is not yet being met? Who is unable to access quality medical care that they deserve? And then, after we ask that question, finding creative and innovative solutions to meet that need. Our mission at the Clinic for Special Children has always been and continues to be our commitment to caring for children and adults with genetic and complex medical needs. And, as of April 1st, doing so in our new building. As you might know, we moved due to severe space constraints in the old building. If any of you visited us in the past year or two, you can attest to the crowding and space troubles that we had there. Sometimes even to the point of having a doctor's visit completed in the hallway or putting many people in the same office. Our number of active patients who routinely seek care at the Clinic for Special Children has grown by 30% in the past 2 years alone. That's almost 1/3 than before. And we're working to expand our ability to serve the community in lockstep with that growth and that need. In our new location, it provides many ways to grow with this need. We have more space, and we can finally, comfortably house multidisciplinary days and multiple specialists coming in. And this cuts down on families' need to come for multiple visits, hire multiple drivers, and can do this all within one setting. We have the space to work through research protocols and exercises to allow our community to have early access to trials for brand new medications and therapies for rare disease. And we have spaces that are modeled in the feel of a living room at home, so that family members who come for longer visits or to see multiple doctors have space to rest and rejuvenate and to meet in privacy and comfort with our genetic counselors, psychiatrists, and so forth. We even have a walking path, a picnic pavilion, and a fully accessible playground, which will open this summer to just allow kids to be kids. Many of these thoughtful accommodations for families who might be going through a very difficult time, these were donated by people here today who care about our important mission, and we thank you for that. We also have the privilege of welcoming many new staff over the past year, including 2 new medical assistants, 1 new laboratory scientist, 2 new research associates, and most recently, our newest doctor at the clinic, Dr. Helga Hartung, who's here today, a very experienced pediatrician and specialist in blood disorders. We also look forward to welcoming Dr. Julia Gorov, a pediatrician, later this summer. These new staff members, now 33 full-time and part-time staff, allow us to continue to serve our community with the same commitment and integrity that we always have. Through this growth, we remain committed to always having the personal touch many of you have come to know at the clinic. We always, as a patient and family, want you to, when you pick up the phone to call, get somebody live, not an answering machine, but somebody who answers your question and immediately can hand you off to somebody who can help. Today, I want to highlight just one example of a creative solution to a problem that's happened more recently at the clinic. This is one of the many things that the Clinic for Special Children does well. We don't often highlight all of these things because they sometimes start simply, not as some big program or feature story, but the simple practice of seeing a need and finding a real, tangible, accessible solution. As you know, most medicines that us doctors prescribe are medicines that you take by mouth. Your thyroid pill, your blood pressure pill, your cholesterol pill. Occasionally, there are other important medicines that need to be delivered directly into your bloodstream through an IV or directly into your spinal fluid through a spinal tap. These we call infusions. These are very specialized medicines, often for rare diseases, and they're given every few weeks or months for years at a time, even a lifetime in some cases. Each of these medicines can cost thousands of dollars, even tens of thousands of dollars for just one dose because of how specialized they are. Outside of the clinic, getting this medicine usually would involve coordinating with a hospital to make an appointment to come into the hospital or to schedule a special hospital infusion center visit. The family would arrive at the infusion center, stay for a few hours or even a whole day. And the cost of these infusions and medications at a local qualified hospital ends up being around $10,000 to $15,000 per visit. And if you need this medication 6 or 12 times a year for your whole lifetime, that cost adds up quickly. On and off over the past 10 years or so, we had helped out families in a pinch for a one-time infusion. As the community need for access to infusions increased, we created an infusion program. Our nurse practitioner, Donna, who most of you know, has been a big champion of this project. Donna and the nursing team take the time to work with drug companies through existing and new patient assistance programs to get these medicines at steep discounts, even at no cost sometimes. We take the time to explain to these companies the Community 4029 exemption and often spend hours ensuring access to these low or no cost medication programs. We've given at least 6 types of infusions to over 20 patients over the past few years. These infusions are for muscle diseases, autoimmune disorders, immune deficiencies, and bone diseases, just to name a few. Because in the new building, we now have an infusion room and comfortable space for children and adults during the infusion, we also have plans to expand this program, adding at least 2, if not more, types of infusions to our list. Since January, we now have 2 infusions per week at the clinic, which is about double what we were doing last year. By a rough calculation, between getting less expensive medications and saving families from expensive hospital bills, over the past years, we estimate a savings for the community around $10 million. And this is through the dedicated efforts of our staff and our nursing. In conclusion, I'd like to thank the Clinic for Special Children's staff, some of whom are here today at the in the back there, and come by and say hi to us. And I'd like to thank those of the clinic who serve on the board of the clinic, who orchestrate and direct us. Thank you again to everybody who made this day possible and all of you who came today. Each part of the Clinic for Special Children that I've mentioned today is not possible without the generous support of our community, local hospitals, and our collaborators. I hope that you enjoyed today in light of our joint mission together to provide accessible, low-cost, and high-quality care for children and adults with genetic and complex medical conditions. Thank you so much.